Now, we have been reporting on how hospitals around the country are being pushed to the limit once again, overwhelmed by patients and struggling with staffing shortages. But one Texas hospital has developed and implemented a virtual intensive care unit to handle the high volume. NBC News correspondent Ellison Barber joins us now from Houston Methodist Hospital with more on this. Ellison, good morning to you. So explain to us how all this works and why they created it.
Hey, Joe, so just walk and look with me for a minute, because this is the virtual ICU Operations Center at Houston Methodist. They actually started developing plans and working on rolling this out about 4 years prior to the pandemic starting. They were getting ready to put things in place, get all of this going as the pandemic hit. And you can imagine, with staffing issues, with surges of COVID patients, this became even more important than they ever expected. They say that this is not a replacement for traditional ICU bedside teams, but it's meant to be sort of an extra team member. All of the people you see here working, they are registered nurses, able to monitor patients, provide advice in real time. Look over here with me and imagine for 1 second that you're an ER nurse. Say you have a patient who needs to go to the ICU, but because of the way things are right now, staffing shortages, too many patients, there is not an available staffed bed. An ER nurse, their skill set is different than an ICU nurse. So say you need to do things like monitor a patient who's on a ventilator because they have COVID, and maybe even wean them off, but you don't know exactly how you should do all that, or you just need a little bit of help. These carts, they are all around the ICU floor in ERs. You can literally, if you're that nurse, push this button here and watch what happens. It calls in, you see the call request sent, it goes to someone in this room. They even have ICU doctors who work and can do things remotely to help. And there you go.
Hi, so this is Casey at Virtual ICU.
Hey, Casey. So I could get real-time advice, guidance on what I need to do for a patient just by pushing this button. They even have camera systems like this installed in patient rooms. So if a doctor or a team is bedside, they can push a button for help as well. Here's more.
The thought process was, instead of trying to have all patients move to ICU when there is no capacity, we brought the critical care to the patient. That has allowed us to deliver care on a fast pace, improved outcomes, and quite a few times, because the care was delivered by our virtual ICU team, our nurse practitioners, especially in the emergency room, allowed us to get them so better that they did not need an ICU. So we were able to downgrade them. So can you imagine, we provide world-class care to the patient, we prevented them deterioration, and we were able to save an ICU bed. Voila.
So you can see here, these are all real patients in the ICU, their vitals. And basically, you have teams on this other side who can monitor this in real time, potentially spot an issue, even look into the room. It sends an alert to the floor if they're going to tap in, and they can notify people of potential issues before it becomes something bigger, perhaps. And you can imagine, in a time of COVID where you're having to don PPE before you go inside, you have essentially more healthcare workers able to be in those rooms and offer help, reach patients a whole lot faster. This hospital, by the way, Joe, they say their early data suggests that this is an incredibly effective tool, because they've seen their codes, their calls for cardiac arrest, drop by 37% in 1 year. They say that is because they have people like these nurses here working in other virtual rooms to help them catch issues sooner. Joe?
Fascinating look inside. Ellison, very quickly here, those who use it, what are they saying about it?
Yeah. They say they like it. I'll let you just listen to what we heard from one ER nurse. Listen.
Before virtual ICU, it was just me. I had to, if I had a medical ICU patient holding, and I didn't have that doctor to run ideas by, I had to, hey, can you pretty please help me out? Now I don't have to go look for that person. They're right there for me. Boom, just hit the button, and they're my resource.
And doctors here who oversee this program, they think this is something that smaller, more rural hospitals that already deal with staffing issues, maybe they could use this to help alleviate some of the issues they're seeing right now. Joe?
Ellison Barber with a look on the virtual front lines. Thank you.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.